Here we are, and there you are. It's a great combination. Take two with Jerry and Debbie. I'm Jerry Usher along with Debbie Georgiani, and we're coming to you today, as always, on the EWTN Global Catholic Radio Network. And you are truly, when we say you're an important part of the program, we truly do mean that. 55 minutes of me and Debbie would get, I presume, awfully boring, Debbie. So we want our listeners to join us. And I think, Debbie, today the topic we're discussing is going to be one that people will have some takes on. I have no doubt about that.
Well, whenever there's change, Jerry, we have a lot to say about it because change is uncomfortable and things that, we get so used to things and then all of a sudden it just, there's an abrupt shift in the way we do things. It's uncomfortable. And we want to talk about that today. So some of us have had some of those uncomfortable changes, and we're talking about healthcare in the United States. And we want to hear from you, basically just maybe how you've learn to adjust or cope, or maybe it's been a blessing for you, the healthcare that's currently available right now, or maybe you've had to overcome certain things and maybe find new ways to have a better outlook, or maybe change lifestyles, or even health regimens just to keep your health up. So we want to hear from you. There's so many angles to this, Jerry, and we can take this in a positive way and really help us to grow spiritually, because we always weave in, Jerry, our spirituality in Take Two, and that's what I love about this show. So dial in, dear listeners. This is the topic today about healthcare in the United States. 1-800-585-9396.
Now we're looking to hear what your experience has been. Obamacare has now been the law of the land for 5 or 6 years now. And just right up front, Debbie and I will say we don't know every jot and tittle of Obamacare and all of this, so it's not so much a conversation of the nuts and bolts, although there are some very significant things we can talk about. The HHS mandate, which was put in there, forcing even religious organizations to cover things like abortion and sterilization and contraception in their coverages. So we can certainly talk about that. A lot of bishops and priests had things to say about that early on when Obamacare came out. But what we really want to know is, see, Debbie, here's the thing. It was a promise of more choices, lower costs. I mean, even the name, the Affordable Care Act. I'm going to just be the first one to offer a thought on this, and that is, I have seen about a 20% increase in my healthcare premium every year since this came out. That doesn't strike me as affordable.
Right.
So, and right now we've got insurance, healthcare providers, insurance companies bailing out because they
can't sustain. Yeah.
Yeah, they can't sustain it. So, dear friends, we want to know, what's been your experience? Has your health care changed? Is it out of reach for you now? Of course, we got fines for those who do not sign up for health care. So, Debbie, this is a topic that touches on everybody's day-to-day life.
Well, it does, and it impacts, like I said at the beginning of the show, you get on a certain rhythm, especially with healthcare insurance and stuff, and all of a sudden when that shifts and that changes and it's uncomfortable, or there's some sacrifice that has to play in, or like you said, Jerry, the rising costs of the premiums, I mean, it does have an impact. It could have an impact on our quality in our quality of life in our families. So we really want to talk about that and maybe support one another and just keep that positive outlook. Let me tell you, Jerry, I was definitely impacted by the changes that were made, and it was. I'm trying hard not to become cynical about it with my doctors. I have to tell you, because as you well know, Jerry, I had thyroid cancer in 1994, and because of that, I don't have a thyroid. I had 2 operations. The thyroid's gone, and so I have a thyroid replacement. I take a synthetic thyroid every day, so I have to take this medicine to live. I don't have a choice. It's not an option. If I don't take this medicine within 6 or 8 weeks, I would just pass away, which actually probably wouldn't be such a bad thing if I just drifted away. That wouldn't be so bad. But
we would never want that, Debbie.
Right. But the thing about it is with the new changing health insurance plans, now they're having I have to jump through hoops. I have to go to a primary doctor to go see my specialist, my endocrinologist, which I have to see anyway in order to get my synthetic thyroid. So I have to jump through all these hoops to get the medicine that I have to take now, which is just mind-boggling because it's not like I have a choice. So it has impacted me personally greatly, plus what you said, Jerry, about the rising costs. But, Jerry, I still keep a positive outlook in the sense that, I'm breathing, I'm alive, I'm still standing, still able to talk about Jesus Christ, especially on a wide platform like Take Two, and so I'm blessed. So that's how I try to keep from getting cynical and bitter about it. And so we want to hear from you, dear listeners, about how you can keep maybe a positive outlook, especially if the changes have become uncomfortable. 1-800-585-9396. That's what we want to hear from you on Take Two.
Yeah, your takes help to drive the show. We got a couple on the line already, and we have still 2 or 3 lines open, and they do fill up fast. And one of the things that Debbie and I really, that does make us uncomfortable is getting to the end of the show and not being able to get some of you on. So please feel free to call right now. Healthcare in the United States is our conversation. Really just looking for your real life, down-to-earth take on when Obama was creating, crafting Obamacare, and what your thoughts were then. And, of course, a lot of things were said, like we mentioned before, that it was going to increase options, it was going to lower costs, it was just going to be this great...
You could keep your doctor.
Yeah, you keep your doctor, all of these things. And this is not a political discussion today. This is just simply... What's been the outcome, the reality for you? Yeah, 1-800-585-9396. Of course, one of the things I mentioned, Debbie, that we have seen play out is the HHS mandate and the lawsuits. EWTN has a lawsuit in the fray there, and I was just very, very blessed when short time ago the Supreme Court, threw out the challenge to the Little Sisters of the Poor. And here just earlier, just about a month ago, actually, in Toronto at the Knights of Columbus annual convention, the Knights gave their highest honor to the Little Sisters of the Poor, and that was for their example of Christian service to the poor and dying and for their commitment to their Catholic beliefs. So I thought that was a very beautiful move on the part of the Knights.
Yes, absolutely. A lot of courageous, brave people really standing up for the truth, and I think that's important, and that's what we're all called to do as Catholic Christians, is to make sure we stand up for the truth. Well, we know what Jesus has left us in our beautiful faith, and to be that witness out there in the world, in the public. And so this is going to be a great conversation. We want you to join in. Don't forget to call in at 1-800-585-9396. This is Take Two with Jerry and Debbie. We'll be right back.
Don't wait another minute. Now is the time to make your plans for the 2016 EWTN Family Celebration. September 17th and 18th are the dates, and Birmingham, Alabama is the place for our celebration of the life and legacy of Mother Angelica. Kids can have a fun-spirational time at EWTN's Faith Factory, where they can meet Brother Leo and sing along with the Donut Man and Duncan. And best of all, it's free. For more information, go to EWTN.com/family celebration.
CNA, the online service from EWTN News, is the only Catholic news source that's fast, reliable, and free with blogs, stories, opinions, and analysis, all at your fingertips. For the latest Catholic news, visit CatholicNewsAgency.com.
Father Larry Richards.
You know, I'm from the city of Pittsburgh, Pennsylvania, and both of my parents, both of them, were police officers. My father was a police officer, and my mother was a police officer. They always thought I'd be a cop, too, and in some ways I am, a spiritual cop. But we keep doing what we do, and we come from wherever we come from, it doesn't matter. Where God is calling us is what's most important.
Open Line with Father Larry Richards, Thursday, 3 p.m. Eastern on EWTN Radio.
This is Bishop Paul Bradley of the Diocese of Kalamazoo, Michigan.
Hi, this is Tim Staples from Catholic Answers Live.
This is Father John Ricardo. Thanks for listening to the EWTN Global Catholic Radio Network.
You are tuned in to Take Two with Jerry and Debbie, and the takes that drive the show are yours at 1-800-585-9396, talking about health care in the United States. How, if at all, has it impacted you? Are you better off? Maybe not so well off right now? Having a little bit of trouble, maybe affording it? I've got a great plan. I have great insurance, but like I said before, the premiums the last 2 or 3 years have just gone up by about 20%. So it gives me concern about where that's going, and so we want to hear from you with your takes. And go ahead, Deb.
Well, no, I chuckled, Jerry, because is that the plan that I had picked out and you had picked out at the same time? I think
might
so.
Be, yeah.
Your plan gets to stay. I just got a letter saying my plan's going to be discontinued at the end of the year.
No
so
way,
that's it.
really?
Yeah, that's interesting. Well, that's good. I'm glad you get to keep it.
Well, as far as I haven't been notified otherwise. I guess I'll find out after the first of the year when I go to the doctor.
Right.
All right, Carmen in Houston, listening to EWTN Radio on Guadalupe Radio. Carmen, you get to go first today on Take Two with Jerry and Debbie. How are you, Carmen?
Doing well, thank you.
Good. Fire away.
Okay, well, I was just very interested in the topic. I recently retired and am still on COBRA, which is a company-provided insurance, because all of my doctors aren't interested in the Obamacare plans. And when I do look for some, they don't have any of the doctors that we have. So it's been a challenge. My youngest daughter is pregnant, and she is on our plan, and any of the doctors that she knows of through girlfriends and such are not on the individual plans. It seems like the doctors like the group plans.
Right. Well, that seems actually, unfortunately, Carmen, that seems kind of what's happening to a lot of people, is that doctors aren't jumping in on these plans, and the PPOs are kind of going away, and it's kind of, we're having glorified HMOs, and so it's interesting. So how long can you stay on COBRA? Is it still 18 months? I can't remember I used to be in health insurance, so
yes, 18 months.
18 months, yeah. So then you really got to do some heavy duty research to make sure your family's covered then.
Right, and the reason I wanted to go to an individual plan is because the corporate plan is very expensive because of recent claims from prior years. And so it's an interesting, we're fortunate in that we can afford the current plan, but as we continue to stay on retirement, which we may not as a result, it's interesting to see how this will all develop.
Right. Well, our hearts are with you. I mean, you're not alone, and unfortunately, I mean, I wish we could say that there's, things that we can look forward to, but we don't know how the insurance companies are going to hold out, because there's just so much they can do, and it's a really unfortunate situation. I think I was in insurance for 21 years, and I've never seen anything like this, with so many companies jumping out of the mainstream. I've never seen anything like it.
I'm going to continue to listen to get ideas.
All right,
okay, Carmen.
Bless
we'll be
your
praying
heart.
For you.
Yeah, we will pray. Thank you. I was going to mention, too, my previous doctor, my doctor right now, I've had for probably about a year, but the doctor that I had searched high and low to find a Catholic doctor, and just somebody I could relate to on that level as well as the level of my health. And shortly after I found him and became a patient, he left practice to go into administration. He just flat out said, I see where this is all going. And he goes, I'm getting out while the getting's good. So it's kind of a disappointment to me. I have another really good doctor now. But anyway, we continue along. Al is in Canada. Ought to have an interesting take on this, listening to EWTN Radio north of the border in Canada. Al, we're so glad you've joined us on Take Two with Jerry and Debbie. Welcome.
Thank you, Jerry. I'd like to offer my international take.
Please.
Well, last year when I was living in America as a Dominican, I got to see the privatized system of America, and I've lived in Canada my whole life, so I've seen both kinds of systems. And with any system, there's advantages and disadvantages with both kinds of systems. But personally, I would prefer the privatized system in America. It's great that you mentioned the Little Sisters of the Poor at the top of the hour. That's one of the advantages of a privatized system. Religious groups and private companies can actually own a hospital, and the Little Sisters of the Poor that was my ministry as a Dominican, was working alongside the Little Sisters of the Poor, and the way they took care of the elderly people, the poor, and those who were too disadvantaged to go anywhere else was just remarkable. I've never seen anything like that here. My mom could tell you horror stories because she works with senior citizens, and it's not so great up here with the publicly owned and publicly funded hospitals and healthcare centers, because if it's someone else's money, the government doesn't care. It's just taxpayer money, so that it's a lot of bureaucracy involved. Another advantage I liked of the American system was the short waiting times. I remember one time here I had to get stitches because of a hockey injury, and it took me like 6 hours to just get to see the doctor, and it was ridiculous. In America, I booked an appointment and saw the doctor within like a few hours or something.
Well, Al, let me ask you that. You said there were pluses for each one. You've mentioned what you think are pluses for the more privatized approach to healthcare. What about it's what, social medicine? Is that how they say it in Canada? What would you say would be some benefits?
Yeah. Well, a positive for the public system is easier access, because everyone is covered under the government's plan. So anyone can see a doctor as long as you're a resident of Canada. Let me think. You also have to. It's not like a totally a public system. I found a lot of Americans think it's totally public. It's more public than private, but there's also some private companies that can lessen the burden and subsidize. Say, for example, drug benefits. I have my own insurance plan with one of them. There's more access to healthcare up here. You get sick anywhere, you just go see a doctor. There's like a clinic on like every block.
Right.
That's the case in America.
So it's more generalized, Al.
Yeah, I could say that.
Al, I just have a question for you. It's a little bit off the subject. I'm just curious. Do you listen to Take Two when you can take your break from studying for your exam that's on September 24th? Do you just take Two to...
Gosh. Well, it's funny that you say that, because all this morning I was applying to the law schools because their application was opening up September 1st. Oh,
wow. Well, I was just wondering if we're like your kind of break that you take from studying for the law exam. But that's good, though. We want to be your stress reliever. There you go.
Yeah, I need a break from all that studying.
Oh, bless your heart. Well, thanks for that international perspective, Al, and know that you're obviously in our prayers. We're waiting to hear after you get your results. And I think I said last time, tell us the day after, but I think probably you have to wait a couple weeks, right, to get the results from the law exam?
Yeah, it's like 4 to 5 weeks or something. It takes a long time, actually.
Okay, so we'll expect to hear from you in October. All right, thanks, Al. Thanks for that. Yes, that we need to know what's going on all around the world, and that helps us to really shape what's happening in our own backyard. So thank you, Al, so very, very much. Okay, we're going to move along to Ramona, listening to EWTN Radio in Washington on Sacred Heart Radio. Hi, Ramona. Welcome to Take Two.
Hi, Debbie. This is Ramona Valley. I just wanted to let you know that a couple of years ago I retired, and I found, actually it was advertised on our Catholic radio, Christian Care or MediShare.
MediShare, right. Yeah.
And I got on that, and it's a very little amount that's automatically withdrawn from my checking account, like $85, and then they'll send you little notes for people that you pray for, which is beautiful. It's validating for, you feel like a closer community. And so I'll send prayers to people that are needing prayer for their medical conditions. And they also send you little notices of people that have pre-existing conditions that are not covered. And then they say, now, if you would, give so much money, it's like under $5, under $2, then this medical pre-existing condition bill will be covered. And I've gotten beautiful letters back from the people I sent money to, saying that they had an abundance of money that went beyond the coverage of their pre-existing bill, and they gave it back to MediShare to help other people. And I mean, and some people just kept it because they had other problems that they needed that money. But I've gotten some lovely letters thank yous, and you just feel like you are part of a Christian group.
Yeah, that is
a beautiful thing, and I think the Catholics are trying to do something, but I never quite, I don't hear that advertising anymore on that one, so...
It's interesting you bring that up, Ramona. I actually looked into one here a couple of years ago. I'm not even sure now. I don't recall exactly why I didn't follow up. But, Debbie, I know you're a little bit familiar with that. But it seems to me that this would be something, and I've mentioned this to some of my brother Knights of Columbus, not anybody at the top level, but I have, with the Knights of Columbus, I have my retirement accounts, I have my life insurance. The Knights offer all kinds of insurance-related products. I think this would be just a natural thing for the Knights of Columbus to get into at some point if that was where God led them.
Right. It's a beautiful concept, Ramona. I checked into it as well when I was shopping healthcare plans. And if it's my understanding, and Ramona, if you could maybe help us and for everyone else that's listening, don't you have to buy in at a certain amount? There's a certain amount you have to pay in initially, and isn't that how it works?
I don't remember buying in. Okay. I just remember I had to take because I wanted this insurance. I retired at 62. And I wanted to, and so you have to have a medical exam and this and that. Okay. And I didn't really buy into it. Oh, maybe I did. I can't, but it was a nominal amount. It was very affordable.
Okay.
Much more than what you would pay in one premium payment. And the beautiful thing about it is that when I took care of my mother years ago, and she was on Medicare and Blue. What happened is that they would always increase the amount of Blue Cross premium, and when the Social Security cost of living went up,
right.
And this doesn't happen. So anyway, I'm going to have to go. Somebody's calling me. But God bless you, and I love this program, and just thank you so much. Bye-bye.
Thank you, Ramona. Thanks so much.
Ramona.
It's a beautiful concept for Christians sharing the expenses for others and helping each other sustain good health. I think it's a beautiful concept, Jerry. And I actually heard of MediShare and the other ones on Catholic radio as well. As Ramona said, she heard it on EWTN. And I think it's worthy for people to look into something like that.
Yeah, I think there are a number of programs. For people to find out more, I would assume you can do an internet search. I would just put in the words Christian healthcare sharing. There may be some that aren't even necessarily Christian based, although I love the concept that Ramona was talking about there, how you have that interaction with those you're directly helping, and you get thank yous and people praying for each other and stuff like that.
Yeah. There's power in that.
Absolutely. Take two with Jerry and Debbie. Healthcare in the United States. What's your situation, dear listeners? Are you doing okay? You hanging in there? Got affordable premiums? Maybe you're a member of one of these medical sharing programs too, and you'd like to share your experience on that. 1-800-585-9396. Judy, we're coming up on a break, but we'll get started with you here and carry you over if we have to. Judy is listening to EWTN.com in Clarksburg, Maryland. Hi, Judy. Welcome to the program.
Hi, how are you?
Doing well.
I wanted to tell you a little bit about what I had to do with my husband because of my insurance at work was very high, even because there's different levels of health insurance that you can get now. It was very high for me to put him on my policy at work. So what I found for him was through Christian Healthcare Ministries, I was able to get him covered under the current laws, so he's not penalized. And then I also found him short-term policies that give him coverage for, most of his medical needs. So, with a little investigation, you can find things that will work for you. But the Christian Healthcare Ministries definitely has allowed us to stay within the law without getting penalized.
Well, that's. I'm glad to hear you share that with us. And if you can hold on just for a quick minute, I want to delve into this just a little bit more, because you brought up this notion of being penalized for not having health insurance, which I've always found to be one of the very strikingly odd parts of Obamacare. That it's I don't know that it's is it the government's right to tell us that we have to have something like health care? I don't know, but. You've obviously found a way to get around that penalty, and we actually have a comment on EWTN Catholic Radio Facebook page as well that somebody has found a way to get around that as well. So Take Two with Jerry and Debbie. Hold the line there. We will come right back with more of your take.
Raymond Arroyo with Mother Angelica, A Remarkable Life. When she was here at Sancta Clara, at this monastery in Canton, Ohio, Sister Angelica had a nickname in the cloister. It was Miss Fix-It. She was the person they turned to whenever the appliances went on the fritz, or in one instance, the leaky basement began to flood. Mother Angelica was called in to fix it. She assembled a crew of fellows from the old neighborhood, became foreman of the project, and it would be the first of many projects this nun would preside over throughout her life. Stay with EWTN as we continue to celebrate the life and legacy of Mother Angelica.
So, what are you afraid of? Some people are so afraid of the pain they never face their own wounds. So afraid of death they never live. So afraid of being hurt they never form friendships. So afraid of failure they never take risks. Fear stops us from living. St. Paul had reasons to be afraid. From 2 Corinthians, he said, 3 times I was beaten with rods. Once I was pelted with stones. 3 times shipwrecked. I spent a night and day on open sea. I've been in danger from rivers, bandits, my own countrymen, the Gentiles. But he also wrote, who will separate us from the love of Christ? Trouble or hardships or persecution or famine or nakedness or danger or the sword? No. In all these we are more than conquerors because of him who loved us. What are you afraid of? Our lives are fragile. So fragile it's scary. If we look to ourselves for security, maybe we should be scared. So maybe we shouldn't do that. Trust him. Be more than a conqueror. This is Chris Stefanik from RealLifeCatholic.com on EWTN Radio.
EWTN. Live truth. Live Catholic.
Thanks for being with us on Take Two with Jerry and Debbie on the EWTN Global Catholic Radio Network. We're talking about healthcare in the United States today. That's what we're talking about. And Judy, you were so kind to hang on. That was the one break we can't move, so we wanted to continue to talk with you. And you were sharing a little bit about how you navigated for your family and how it's working. So just rewind about 10 seconds and get us caught up, and so that we can jump in.
So my husband, to include him in my work insurance, it was going to be very expensive because of his age and how the bans are in the state I live in. So I was able to work with an agent, and we found a short-term policy that he just continues to renew, which is cheaper than the levels that are required in the state. And then what we did is we got Christian Healthcare Ministries, and we pay that each month, and it's really a very inexpensive program. And we just pay that monthly, and it covers us under the federal law. So it's a workaround for us.
Mm-hmm.
Yeah, Judy, if I may ask, how is the care, the coverage, the services that you get with the Christian Health Share Ministry?
To be honest with you, he hasn't had to use it because he has the other insurance to that he uses for his regular care. It's just in case something major happens, we have it, and it really keeps us from being penalized.
Well, that brings up a good point. I have to just say something because I think our listeners know by now that I'm a certified health coach, and I firmly believe in self-care. I really do. I think we all have to take it upon ourselves to take care of ourselves physically and have a balanced diet and really work on all aspects of ourselves so that we can have that self-care in place first. Because Judy, it sounds like you've got 2 policies side by side. One being one, like you said, for major things, and then you've got the short-term policy, and that's I'm glad it's working. Let me tell you, I mean, God bless you. I'm glad it's working, but that's got to be kind of a little bit, maybe even hard to keep up with and navigate because you've got to constantly be thinking about that. That short-term comes up for renewal every so often. So, I mean, that takes a lot of dedication.
Yes, it does. But for what we save in premiums,
right,
it works for us, and we just pay certain things out of our pocket because we're paying less in premium. So for us, yes, we have to be a little bit more careful with how we, go to the doctors and our prescriptions and shop around. But it's definitely saving us a lot of money, but we still have the coverage we need.
Well, congratulations, Judy, on that. And thanks so much for listening and for calling in. Hope that we'll keep you as a listener and hear from you again some other time. Can we count on you for that?
Sure, thank you.
All right, Judy, thank you. That will free up a line at 1-800-585-9396. The conversation there with Judy, Debbie, also triggered in my mind that, we could do a whole show on this sometimes, but I think one of the problems we have with the healthcare system is people who abuse it. Judy was talking about she and her husband, they do whatever they can not to go to the doctor.
Exactly.
I'm that way too.
Me too.
I don't, if there's not, if I'm not, if I don't have a severed limb or something, I'm just not going to go to the doctor.
I'm right with you.
And yet I've known people, I'm sure you have too,
that run to the doctor
little
for
sniffle. They're in the emergency. So, I mean, there has to be some accountability and responsibility on our part to try to keep the costs of healthcare down by not just seeing it as a Band-Aid for every little thing that ails us.
I agree. That's why I mentioned the self-care. We really have to take care of ourselves. So yeah, absolutely. I'm right in agreement with you, Jerry. Okay, Ethel, you've been waiting so patiently. You're listening to EWTN Radio in Scranton, Pennsylvania, and JMJ Radio. I love that, JMJ Radio. Hi, Ethel. Welcome to Take Two.
Hello. Okay. Now, I understand that you're interested in some of our experiences.
Yes.
Sure.
And okay, I had 2 hospitalizations, one in 2014, one in 2015. But the first, I had no idea that you couldn't have your own physician. And I understand now that I'm having a problem, and I cannot have my own physician if I go to a hospital. I had a new physician. But I understand that no doctor is allowed in these hospitals to take care of their patients. It's all taken care of by their own personnel. I'm wondering if anybody has had that experience and how they reacted to it and how they feel about it.
Ethel, are you talking about that PAs are taking over for doctors? Is that what you're talking about? Physician assistants?
I'm not sure I follow what you're saying.
Okay, are you saying that the doctor doesn't come to see you and care for you? There's somebody else like his assistant that takes over?
Yes, they're hospitalists, as they're called now. Some of them are hospitalists, and they take over. And then you're released to see your own physician.
Oh, okay.
But anyway, another main point, I was eager to let senior citizens know that if they ever had any experiences like I did, after I was admitted and out of emergency, and I was sent to another floor, and they start performing some procedures on me. They never said a word. This one nurse came by my bedside and said, "I'm going to be your nurse today." Didn't say hello, goodbye, how are you, whatever. And she came back in, and she was rolling something up at the foot of the bed in her hands. And I realized that she started putting it on my foot. And I thought, oh, good, I love something nice, stockings on my legs at night especially. And never said a word. And I felt this tremor going up my side of my leg. She had turned on an electrical button or whatever. And I felt these waves going up and down the right side of the leg, down the left, and up and down and down. And it became more and more intense. But I thought, okay, I'll just turn to my side, and it'll be relieved. And I turned to the other side. And to get over that subject, I buzzed for the nurse frantically, and I told her, turn that thing off, turn that thing off. She did, and she left the room. And I thought, this is so strange. I couldn't believe that was happening. Never said a word. And, of course, I was so upset over it. I never even thought to ask, what are you doing and why and whatever. And then I thought I was going to be discharged. The next morning, I wasn't, of course, that night. The The next morning, somebody comes in with a stretcher, and he's putting on his rubber gloves, and he said, I'm going to take you to X-ray. And he said, I'm going to take some blood first. And I said, oh, why? And he said, they want to check your blood every 2 hours from that point until 6 in the evening. Now, that would have been about 8.
Right.
But anyway.
Well, but Ethel, can I jump in real quickly, because I think I know what's happening here, because I've seen this before. You were saying that with seniors, because you were addressing other seniors that might be listening to the show. It sounds like that procedures were ordered for you, and without you really knowing what was happening or what you have agreed to. And this is what I've always said, that this is why families and friends need to be advocates for our senior citizens. My mother was just recently in the hospital, and my sister and I were there quicker than you could even imagine, because I didn't want procedures done to my mom unless we had talked about it as a family. And it's important that we do speak and help our senior citizens to really know the choices that they are entering into with these procedures, so that there's not all these unnecessary tests being done, and also the tests cost money. So at the end of the day, somebody's going to get hit with that big bill. And so I think, if I know where you're going, Ethel, it's important for us to really be aware of what's happening in our offices, in the medical offices, and in the hospitals, and to know what we are agreeing to. So, do you have a family member or friend that is with you and supports you when things like this are happening, Ethel?
No. In fact, they were more. In fact, my one daughter was furious when I refused. She got in my face, and I mean literally in my face. It was just shocking, because she's supposed to be a very, good person. And she said, you let them do whatever they have to do, and you don't you dare question them, and blah, blah, blah. And I thought, oh, my goodness, I pushed her away from my face. And that was the end of that. But I have been castigated by my family members that I should have let them go ahead and do this, that, and the other. And I had already had catheterization. I had already had X-rays, and they were trying to impose antibiotics on me, which I refused. Antibiotics. After they tried several times and tried to insist that I take them, and I said, will you do me one favor, just give me the literature on it. I'd like to know all about that drug. Well, when I heard the sad after effects that occur and have occurred, I thought there's no way that I would ever put that in my system. But my family is...
Right.
Yeah, look, I was going to echo what Debbie said, and it really is important that you have an advocate. And it's unfortunate that your daughter apparently just didn't have the interest at the time, or whatever the circumstances were. We weren't there. We don't know, but. Certainly, it would be important for you to try to find somebody, maybe even ask if something else happens to you, you end up hospitalized or needing medical care of some kind. Ask, say, is there a social worker, is there an advocate, somebody who can help me make these decisions and know what is being administered to me and why? Because those are very important decisions. Not only the cost that Debbie mentioned, but really, we all should take control of our own health.
Absolutely.
And our own health care. So, Ethel, thank you for that call. Bless your heart. We're going to keep you in our prayers. And we do hope that you'll listen and call Take Two with Jerry and Debbie again. All right, we're going to get to Sandra next, listening in Michigan on Baraga Broadcasting to EWTN Radio.
Baraga. Yay.
Yeah, welcome. Baraga just joined us about a month ago to the lineup. So, hi, Sandra. Welcome.
Yes, hello.
How you doing?
Thanks.
Oh, I have mixed feelings about Obamacare. I have a 40-year-old son who was finally able to obtain insurance when Obamacare came out. But most recently, I'm a senior on Medicare and Blue Cross Medigap. I received a letter saying that my Medigap policy was going up $100. And my sense is that the insurance companies are not making the profits that they used to make, and sadly they're raising the rates on the elderly and the handicapped. So I have mixed feelings about it, and I just wanted to share that. A lot of people are getting insurance that couldn't get it before, and that's a plus. But then rates are going up, so co-pays and rates are all going up. So
yeah, well, unfortunately, Sandra, they're for the most of us, they are going to go up, and that's the unfortunate thing. But it sounds like you got a good outlook towards it, and you're able to cope and to thrive. It sounds like so that's good. And I mean, I guess we just have to really. I still am a firm believer. I've always said this, Sandra and Jerry, that we've got to take our own care into our own hands, our self-care. We've got to be our own doctors in a sense, to navigate what procedures we're going to go for and not. And I believe in my heart of hearts that we just have to hold on to a strong faith that the good Lord in heaven will provide everything we need and sustain us and let us get through these somewhat maybe even financial or troubled waters that we might be entering into. Because, I know Sandra, I have a friend right now that cannot afford the healthcare hikes that are going to be happening, and she's very stressed, very troubled. So it is difficult.
$100 is a lot.
Yeah. Is that $100 a month that's going up?
Yes, I'm on a Medicare legacy policy with Blue Cross.
Right. Well, we're gonna we believe in the power of prayer, so we just have to all just really lock arms in prayer and hope we can all get through this together and be healthy through it and have good outlook towards it. So thanks, Sandra, for your call today. We appreciate it, and God bless you. Thank you.
Yeah, good to hear from you, Sandra. We will keep you and all of our listeners in our prayers. We've got time to get to a few more of you here, so thanks for your patience on the line. Take two with Jerry and Debbie discussing health care in the United States and how you're faring with the changes, Obamacare, and things that have been going on and how you've been impacted by that. So, Rosario, we're going to go to you next, listening to EWTN Radio as you drive through Washington, D.C. Hi, Rosario. Welcome to Take Two with Jerry and Debbie.
Yes, good afternoon, and thank you for taking my call.
Sure.
I would like to offer, I'd like to offer a suggestion at the same time that I'm going to beg for your prayers, and I'll tell you why. The first thing I want to offer is for all the listeners in the United States to be very vigilant to protect their health care that they have today. For better, for worse, there is medical care and there's access to medication. And I'll tell you why I'm saying that. I do live in the Washington metropolitan area, and right as I'm speaking, I'm heading back to Washington. I was at the beach, but I'm heading back to Washington for a very important cause. And I'll tell you what that is in a second. Up front, I want to clarify who I am. Because in everybody's minds right now, this is so important. I want to tell you that I have been a dual citizen of the United States and Venezuela since I was conceived. I used to say since I was born. Now I'm saying since I was conceived.
Good for you.
The second point I want to make is that I have been in the United States for over 40 years, and in my professional career, I was a human resources officer for a large organization, and I spent 32 years working there. I recently retired. In my role, I was in charge of overseeing 39,000 employees of this organization, and one of my biggest concerns was health care. And it evolved originally in 1982 because of my husband's cancer. And I won't go into details because there was a lot of complications, but I found myself in 1982 suddenly laid off because of the economy and my husband needing attention for his cancer. And after that, I found employment again, and I said to myself that I would stick it out, come whatever came, to assure that at the time I retired, or from there on, that I would have health care, and at the time I retired, I would have health care for myself and my husband, and which I do have now. I have retired, and I do have that health care. I have Medicare, and I have that health care. So I'm extremely fortunate, but I had to work very hard for that, to protect that throughout the years. Now, the important thing is that I also have insurance for prescriptions. So having laid out that scenario, I wanted to say to the listeners that here in the United States, at least you still have access to health care, to doctors, and medications, prescriptions, medicine. But most important, even before all that, the way I was raised was to eat healthy. Everyone knows of this Mediterranean diet. That's what I have always followed. Exercise and eating healthy. I am very fortunate. I am extremely healthy at my age. I don't take a single prescription. So, and same for my husband. Okay, having said that, that's critical. I heard one of the speakers, I think she's a nurse, saying that we need to take responsibility for our health. That's absolutely true. Am I still on the air?
Yes.
I heard amazing. Okay. So I have laid out the scenario. So getting back to my point I wanted to make, and also begging for your prayers.
All right, be as quick as you can, Rosario. We've got a couple of other callers we want to get to.
Okay, I said I was heading back to Washington right now because all Venezuelans in the Washington metropolitan area and the surrounding states are going to be standing this afternoon between 3 and 6 p.m. in front of the Venezuelan embassy asking for a referendum to revoke the current government, which has purposely created genocide due to lack of medications and food. They have not permitted any help to come in, Red Cross, Caritas, Americare, to go into the country. So from the Washington area, I have been going to all places, neighbors, friends, Goodwill, to thrift shops, and buying all I could get my hands on of medical equipment, wheelchairs, walkers, orthopedic measures.
Rosario, we can assure you of our prayers for this cause.
Yeah.
It's something I'm not personally familiar with, but it sounds like it is something that you are very passionate about, and we will certainly support you with our prayers and pray for God's holy will to be done, and really appreciate you just being so actively involved in certainly the care, the solicitation, or the solicitude, I should say, of the well-being of other people. So, Rosario, thank you so much for the call. We really do want to try
drive
to
safe.
Yeah,
Yes.
Drive safely there in Washington, D.C. Got to be a few other people on the road with you there, so hope all of you are safe. And thanks for calling Take Two with Jerry and Debbie. Mary, listening to EWTN Radio on iHeartRadio in Allentown, Pennsylvania, is next. Hi, Mary. Welcome to Take Two.
Hi there.
Hello.
I just wanted to alert some of your callers about an issue that came up for me last summertime. I actually participated in a peaceful prayer vigil outside of abortion clinic. Came home, was hot, and I got a phone call from a survey from Franklin and Marshall College asking me about my health care and what I thought was good about the new Obamacare. But one thing came up through the survey, and he says, would you like your doctor to give you end-of-life counseling? Well, that was a game changer, and I kind of went off on him. And I said, no, I do not want my doctor to give me end-of-life health care counseling, because I feel truly that with the government situation right now, within our health care, the government will try to look for ways to cut costs. And all the surveys have showed that, health care, most people use most of their health care at the end of life. Okay? Wonderful grandmothers and everybody in our families use it mostly at the end of life. I'm really concerned that at some point they may mandate registered nurses and doctors to be giving the patients lovely, shiny copies of ways to receive counseling for end-of-life care. You know, sometimes when patients get these kinds of things, they don't understand a lot about it. They'll see this stuff and say, well, gee whiz, maybe this is a good idea. Maybe this is something that my doctor wants me to think about because I trust my doctor and he's, you know, given me this thing. Maybe I should think about not being a burden. Maybe I should think about planning. And we all like to plan, you know. And I just want to alert people that this is coming because the government will want to find ways to cut costs, okay? And doctors and nurses are all about optimizing life. We want to help you to maximize your health and your happiness in life. And I honestly think if I had to give some shiny papers that discusses end-of-life care to patients, I might have to resign.
Mary, thank you for sharing this. And I was rather alarmed here recently when I made the comment to somebody who I believe was in the medical field that, well, isn't it just part of the training of a physician to take the Hippocratic Oath? Basically, if I can just paraphrase it, do no harm, you know, do good, treat people, basically do no harm to anybody. And I think if I heard it right, this person told me that's no longer a part of their being made a doctor or whatever. And I thought, oh boy. So I may be wrong about that. I'm just recalling that vaguely here, but let's face it. A lot of older people and those terminally ill and so forth definitely do feel, in some cases, Debbie, I think, an obligation because of the philosophies and ideologies that are swirling around them as they lay there in their hospital bed, and these forms and suggestions that Mary is talking about. If they're not already here, they are certainly going to be coming sometime very soon.
Yeah, but Mary, that's just it is alarming what you shared about that survey that you were given, and I just want to say you have a really great heart. And you're right about nurses and doctors are supposed to be really extending life and optimizing life and making life abundant and full. And so we have to maintain what we're really here on earth to do. And that is to maximize the amount of time we have here to live out our purpose. And Mary, thank you for just inspiring us with that call. Sarah and Al and David and Chris and the others, we're so sorry we couldn't get to you. We wish we had another hour to discuss this, but we don't. But we'll be back again tomorrow, Jerry, which I'm excited. We've got our first unscripted show together.
That's right. Anything you want to share a take about tomorrow, or if you want to ask me or Debbie anything about ourselves, our ministries, we're just going to have an open discussion. It's unscripted tomorrow on Take Two with Jerry and Debbie. Until then, have a beautiful
and blessed day.